down with Dr. Lisa Ashe, Director of the Concierge Medical and Wellness Provider Be Well Medical Group, to share what travelers need to know about the Zika virus. Dr. Ashe, thank you so much for being here.
Absolutely.
This is actually a concern of mine. I live in South Florida. I get a lot of questions about this. So let's start at the beginning, and can you tell us what actually is the Zika virus?
So the Zika virus is much like many of the other viruses, cold, flu, and it causes cold and flu-like symptoms. And so it's caused by a mosquito bite, but that in a nutshell is what it is.
Okay, so some of the same symptoms that you would get, you would kind of feel achy, flu-like symptoms.
Sure, you can have, many people have a fever, some have red or itchy eyes.
Okay.
You can have gastrointestinal symptoms like nausea, vomiting, joint pain, muscle aches, and so you feel like you have a bad cold or the flu. And then on the flip side, there are others who have no symptoms at all.
Okay, so it's basically if I'm outside in an area that has the Zika virus and I get a mosquito bite, and then I start noticing the symptoms, then what should I do?
You should be tested for it. Most hospitals and physician offices will send the lab off. There's urine and blood tests. They'll send it to the state health department.
Okay. And what are some of the health problems that people can have if they are infected with the Zika virus?
So overwhelmingly, for most adults and even children, as long as you're not pregnant, you will just have those symptoms and you treat them by treating the symptoms. So increasing fluids, you can take Tylenol, ibuprofen for muscle joints, aches, and you just, it'll resolve on its own. It's very self-limiting.
Okay.
If you're pregnant, you worry about some birth defects. And so you've heard of the microcephaly. Most of them are neurologic birth defects, which can happen in pregnant women.
Okay.
In a rare population of non-pregnant women, you can also get some neurologic deficits, but that's very rare. We don't have a lot of studies on that yet.
Okay. For people who are traveling to areas that have had cases of the Zika, what kind of precautions can they take so that they won't be infected?
So basically, it's going to be preventing mosquito bites because aside from Zika, there are some other dangerous viruses that you can get from mosquito bites, especially in South America and in the Caribbean, like dengue fever.
Okay.
So in general, we just recommend for and it's hard because if you're on vacation, you're not going to want to fully cover up.
Yes.
But
so what are some of the things, like let's say I'm going to the Caribbean soon, which I can't wait for. So what are some of the precautions that I and other women can take? Well, actually, I do have a question. Do the men also have to as much worry about getting bit as women?
So the Zika virus is the only one that is transferred, in addition to mosquito bites, sexually transmitted. So if your partner is pregnant or you're going to be pregnant, then the men have to worry as well.
Okay.
And that's different from Lyme disease. That's different from all the other mosquito bites. That's what makes Zika, I think, more dangerous, is because it's an added transmission in blood. So with blood transfusions, sexually transmitted, and so there's an extra worry there.
Okay. Besides bug spray, mosquito repellent, I have one of those kind of clip-on repellents. Any other precautions that I could take besides covering up?
Sure.
But as you know, living in South Florida, it's quite hot. So any other things that I should kind of just be mindful of?
For the repellent, you want to make sure that it's approved by the EPA. And they have a website, and you can go. And so if citronella is your choice of bug, repellent or whichever kind, you can check to make sure yours is EPA approved. And then secondly, for those who live in South Florida or other places, you want to make sure that you don't have standing water near your house because those things attract mosquitoes. Okay. And then you want to be careful about dusk and dawn. So especially those are the time when you have a high rate of mosquitoes and decrease your chances by not being out and around those times so you don't get bit as much.
Okay.
And then other things, colors do matter. They are attracted to, bright, vibrant colors.
Which is so
which
hard.
Is hard.
Which is so
hard in Florida
Yes.
and in the Caribbean. But those are just some of the things that, you can do just because we don't have a vaccine yet. And so other than, that's what we need to get a vaccine, but just preventing the mosquito bite itself.
Okay. Any other last advice you want to give to our viewers?
If you are pregnant or you want to be pregnant soon, you do want to get tested to make sure that if you've been to an area, you live in the area, you want to be tested to make sure you and your partner haven't actually contracted it.
Thank you so much for joining us. Thank you. We're going to take a quick break, but when we come back, Bobby is sending us to Cartagena, Colombia on the go, powered by Trivago.com. Don't go anywhere.
Stay connected to the Jet Set from wherever you are in the world. Download the Jet Set app today and fly with us via social media. You may even land on the show.